Hello everyone, today we will discuss staging in AVN hip and I'll try to make it as simpler as possible. The original Ficat and Arlet staging wherein they gave 4 stages and it was based on plain radiograph. MRI was not included. This was pre-MRI era when the MRI was not included. They gave 4 stages, and to describe this, the stage 1, the pre-radiological stage, what did they used? They used number 1, the bone scan, and also the functional exploration of the bone. This has been modified, and what we use today is the modified Ficat and Arlet staging, wherein they gave 5 stages from 0 to 4. Now coming to the stage 0, which is also known as the pre-clinical stage. There the radiographs are normal. It is also known as the silent hip. So what is this class? Whenever the disease is in one hip, the other hip is belonging to this stage. This is the stage of the other hip when the one hip is having AVN. Now coming on to the stage number 1. So stage number 1 is known as the pre-radiograph stage. The first one is the preclinical, the second one is the pre-radiograph stage. Pre-radiograph means the radiograph again will be normal in this stage, or either there might be some osteopenia. So what will be abnormal? The MRI will have edema. The bone scan will have increased uptake. Clinically, the patient will have pain. So whenever we have a patient with a painful hip and with limitation of movement, but the X-ray is normal, we always think about this pre-radiograph stage number 1. Now the stage number 2, which is also known as the pre-collapse stage. Herein, the X-ray will show the sclerotic changes and some cystic changes as well. There's a mix of both. The MRI will have the geographic defects, and the patient will have, with the pain, the patient will have stiffness present. This has been further subdivided into the stage 2A and stage 2B. All of these are in Roman numbers. This is stage 2A and stage 2B. The 2A will not have the crescent sign, while stage 2B has crescent sign present. The crescent sign is present, but there is no flattening of the femoral head. So the stage number 3 is the stage of early collapse. The X-ray will have flattening of femoral head, or we can say the collapse is present over here. So the patient will have limp in this stage. And the last stage, the stage number 4, is the stage of osteoarthritis, where the joint space will be reduced, osteophyte will be present, and even acetabulum changes will also be there. So these are the 5 stages of modified Ficat and Arlet staging. Now what was the problem with this Ficat staging is that it lacks the intra-observer and even inter-observer reliability. Second, there is no mention of the size of the necrotic area and what is the location of the necrotic area. So this is not mentioned here. So we cannot, it's very difficult for us to measure the disease progression in case of modified Ficat and Arlet staging. There is another staging, 2019 ARCO staging. ARCO, the full form is Association Research Circulation Osseous. Herein, the staging is again, here it is 1, 2, 3 and 4. Again in the stage 1, the X-ray will be normal. MRI might have some low signal band in T1 weighted images. In stage 2, even the X-ray and the MRI both will be abnormal. That means the cystic sclerotic changes will be present in the X-ray. And in stage number 3, there will be subchondral fracture, which will be present on the X-ray or CT scan. this has been further subdivided into 3A and 3B. This I'm talking about the 2019 one, where the femoral head depression, if less than equal to 2 millimeter, it is 3A. If it is more than 2 millimeter, it is 3B. And the last stage is the osteoarthritis stage. So this 2019 modification, the stage 0 has been deleted and the stage 3 has been further subdivided into stage 3A and 3B. So what is lacking in all of these are the size and the location of the necrotic area. It is not included in both of these staging. So this has been incorporated in certain staging where they calculate the size and the location of the necrotic area. The one staging is Steinberg classification. The second one is the Japanese investigation committee. The third one is the modified Kerboul classification, where they include what is the size of the necrotic area. For example, in case of Steinberg, they have further subclassified each subtype on the into mild, moderate, and severe, on the basis of if less than 15% of the articular surface or the head is involved, then it is mild. If 15 to 13% of the femoral head is involved, then it is moderate. If more than 30% of the femoral head is involved, then it is severe. And similarly, Kerboul has also given a classification. They have measured the arc of the necrotic area both on the AP as well as the lateral X-ray, and both the arc they have calculated and they have summed both of them. And whatever it is, the sum is there of the two angles, they divided it into either a small lesion, a medium sized lesion, or a large sized lesion. A small lesion is the one where the combined necrotic angle is less than 190 degree. If the combined necrotic angle is 190 to 240 degree, it is a medium. If it is more than 240 degree, then it is a large lesion. Now coming on to this one, the Steinberg University of Pennsylvania. Herein, they have classified it into 7 stages from 0 to 6. Now, talking about each of these stages one by one, the stage number 0 will have, we can say, a normal X-ray or a non-diagnostic, X-ray, or even the bone scan, or even the MRI. These are either normal or either non-diagnostic. In stage 1, the X-ray is normal. However, the bone scan and the MRI, both of them are abnormal. In case of stage 2, now the X-ray will have changes. That is, the cystic and sclerotic changes will be seen in the X-ray. In stage 3, subchondral collapse will be there. That means crescent sign will be positive in case of stage 3, but there is no flattening of the femoral head here. So the next stage will have the flattening of the femoral head. Then stage number 5 will have joint narrowing with or without acetabular changes. And the last stage, stage 6 will have advanced degenerative changes. Now, as we have read before only, the stage number 1 to stage number 5, they are further subclassified into A, B, and C, that is mild, moderate, and severe, on the basis of less than 15 degree of femoral head is involved, or 15 to 30% of the femoral head is involved, or more than 30% of the femoral head is involved. So this is overall the staging of AVN head, femoral head. Thank you.